Performing a surgical procedure on the wrong part of a patient's body or on the wrong patient is something that should just never happen, but it does, and we haven't been able to eliminate it despite a large amount of effort across the United States, indeed around the world, to get rid of this problem. The Joint Commission's Center for Transforming Healthcare worked with a number of hospitals and ambulatory surgery centers using a much more effective set of problem-solving tools to understand why this problem is so persistent. And one of the things that we found is that risks of wrong site surgery start creeping into the surgical process long before the patient actually arrives in the operating room. So, for example, we found that 39% of cases that we studied had risks for wrong site surgery introduced at the time the surgical procedure was scheduled. What the Joint Commission's Center for Transforming Healthcare has done is to compile a very effective set of solutions that address all of the major risks of wrong site surgery, whether they occur in the scheduling process, in the preoperative assessment of patients, or in the operating room. And now we have tools that we can deliver these solutions to hospitals and ambulatory surgery centers around the country. Any organization in which surgical procedures are performed is at risk for a wrong site surgery event. And if you haven't had one of these events and haven't really understood where your risks are, then you don't know what your risk of having one of these events is. These tools will help you measure exactly what your risk of having a wrong site surgery event is. So that's why organizations that do surgery should use the tools.